As hundreds of tests for COVID-19 go to the CDC every day, there's another test created by a University of Florida scientist that is helping researchers.
It allows them to test Floridians who might have the virus but don't have symptoms.
When you have a national tragedy like this, an outbreak, if the country's unprepared, you have to be able to give academic research centers the ability to do their part.
News4Jax reporter Janice Harris found out the UF test is being used right now throughout the state and in Jacksonville. Janice.
Mary, that's right. It's very similar to the CDC test in the sense of trying to find out if someone has COVID-19 or not. But it's different. This one was created by a University of Florida scientist and is being used right here at UF Health, but it's also being used throughout the city and the state.
I have been studying viruses for over 35 years.
This is Dr. John Lednicky. You may not know his name, but you know his work. Lednicky created a coronavirus test 4 years ago. Now that same test is being used to identify the virus in people that are not showing any symptoms.
The most important thing right now is to understand how the virus is spreading through the community.
As a child, he was in the Philippines with his father when he had bat soup. Shortly after, he became sick with a severe viral respiratory infection. He didn't know if he got the virus from the soup, but ever since, as an adult, he's been researching coronaviruses for 35 years. 4 years ago, he created what is being called the UF test. It detects COVID-19.
The virus is much more widespread than anybody previously thought. That's very important in learning how to control the virus, how to contain it.
The test is being used here at UF Health, the villages in South Florida, and also throughout Jacksonville. His testing is part of UF Health research, but it's separate from the CDC. Many lessons are being learned.
You might be negative today, but 2 days later, you might be positive, right?
Lednicky says we don't know if there will be a second wave of the virus, but he warns people should protect themselves from the possibility of getting COVID-19. And it's not clear how long this testing will go on with the UF test. It has to be funded. But until then, they will continue to see if there is a difference in those that have asymptomatic symptoms. Reporting live from UF Health, Janice Harris, Channel 4, the local station.